All right, let's get right into it. We're going to be cracking the code on one of the toughest parts of the NCLEX, maternity nursing. My goal here is to break down those super important, high-yield concepts so you can walk into your exam feeling ready and confident. Look, we all know the NCLEX is a total beast, right? It's a marathon. You've already put in so much work, countless hours in class, in clinicals. So this isn't about cramming more facts into your brain. No, this is about strategy. It's about learning how to think like the test makers think. And I've got to give a huge thank you to Dr. Abdulkareem. He provided the core material that we've built this entire review around. His insights have been absolutely clutch in helping us zero in on what really matters for test day. Okay, so here's our game plan. We'll start by decoding the NCLEX challenge, then hit those critical pregnancy red flags, figure out fetal heart rates, master the 4 Ps of labor, run through some NCLEX priority actions, and then wrap it all up with a final review to make sure it all sticks. Let's do this. First up, pregnancy red flags. You know, the NCLEX just loves to test your ability to tell the difference between two conditions that look almost the same but require totally different actions. Your job is to spot those little details that basically scream danger. Okay, this is a classic NCLEX trap, placenta previa versus abruptio placentae. Here's how you're going to nail this every time. For previa, the keywords are painless and bright red bleeding. The uterus is soft, it's relaxed. For abruptio, it's the total opposite. Think intense pain, dark red blood, and a hard, rigid uterus. The NCLEX will paint a picture, and these are the keywords that give you the answer. Here's another favorite NCLEX topic, figuring out how bad a condition is. Take preeclampsia. It's not just about knowing what it is. You have to know when it's escalating into a life-threatening emergency. So look at the difference here. The blood pressure skyrockets. That little headache becomes severe and persistent. Suddenly, she's seeing spots. She might have that awful epigastric pain, and her platelets are tanking. These are the signs that tell you, we have a major problem here, and we need to act now. Okay, let's switch over to the fetal monitor. This is where the NCLEX really tests your interpretation skills. What is that squiggly line really trying to tell you about the baby? Late decelerations. You know, the name tells you everything you need to know. The key word is after. The heart rate drop starts after the contraction is already at its peak. The baby's heart rate is late to the party, and that is a really bad sign. It tells you the baby is struggling to recover. So why is it late? What's the big deal? It all comes down to one scary phrase: uteroplacental insufficiency. Basically, the placenta is failing. It's not getting enough oxygen to the baby during a contraction. This is a huge red flag, and the NCLEX fully expects you to know exactly what to do when you see it. And here it is. This is your what do you do first playbook. First thing, you immediately get that mom on her side. You gotta improve blood flow, then you put on oxygen, crank up the IV fluids, and if oxytocin or pitocin is running, you stop it right away. It's making the contractions worse. Then you call the doctor. You have to know this sequence cold. All right, let's shift gears and get back to a foundational concept, the 4 Ps of labor. If you can get your head around these 4 key elements, you'll have a solid framework for just about any labor and delivery question they throw at you. First, powers. Simple enough, right? This is the engine of labor. It's those powerful uterine contractions plus mom's pushing efforts. If the powers aren't strong enough, labor stalls. It's all about the force. Next up, the passageway. This is the path the baby has to travel. We're talking about the bony pelvis and all the soft tissues. If that passageway isn't favorable, well, that can be a major roadblock to a vaginal delivery. The third P is the passenger. And yeah, that's the baby. But it's not just about the baby's size. It's about how they're positioned for the journey, their presentation, their position. A baby that's sunny side up can lead to some wicked back labor and slow things way down. And finally, the fourth P, and please don't forget this one, psyche. A mom's emotional state, her fear, her anxiety, that can literally change the course of her labor. A huge surge of stress hormones can actually make her contractions weaker. Your support is a physiological intervention. Okay, foundations are set. Time for a lightning round. This is where we take all that knowledge and sharpen our clinical judgment. I'm going to throw a classic NCLEX scenario at you, and I want you to think, what is my number one priority? What do I do right this second? So you're looking at the monitor, and you see these sudden, sharp, V-shaped drops in the baby's heart rate. They're deep, and they're lasting a minute or more. What should be screaming in your head right now? It should be one thing. cord compression. So what's your move?
Here's your action plan, and yes, the order matters. Stop the Pitocin. Change mom's position, try getting her on her hands and knees, anything to get that baby to shift off the cord. Slap on some oxygen, give some IV fluids to boost hydration, and then you've got to do a sterile vag exam to check for a prolapsed cord. These are the immediate life-saving steps.
Okay, new scenario, and the stakes are even higher. Your patient with severe preeclampsia is now having a full-blown seizure. This is eclampsia. It's a crisis. In all that chaos, what is your absolute #1 non-negotiable priority?
Your #1 job is patient safety. You never, ever leave the patient. You stay with them, you scream for help, and you make the area safe. Turn them on their side immediately to protect their airway. That seizure is robbing both mom and baby of oxygen, so you get oxygen on them fast. Safety and airway, airway, airway. That comes before everything else.
Okay, deep breath. We have flown through a ton of critical information. Now let's just boil it all down and cement those absolute must-know concepts that you've got to have locked in. Honestly, if you walk away remembering just this slide, you'll be in great shape. Placenta previa, painless, bright red. Abruptio, painful, dark red. Late decels mean a placenta problem. You reposition and give oxygen. Variable decels mean a cord problem. You reposition and give oxygen. And eclampsia means seizure. You stay with your patient and protect that airway. These are the heavy hitters. They show up again and again. So we'll end on this. Look, you have the knowledge, it's in there. The final piece of this whole puzzle is your mindset. So I want you to think about it. What is your #1 strategy to walk into that testing center, manage the stress, stay focused, and trust all the hard work you've put in? Because in the end, that confidence is what's going to carry you across the finish line.